Except for, all right, then I'd like to turn this over to Laura Allen, who's going to be our moderator tonight with a special guest.
Thank you, Terry. Welcome, everyone. It's great to see so many people here. Hello, Senator Reynolds. We're so glad you could join us tonight. So if anyone has any questions for the Senator, please put them in the chat. We do have questions already submitted, and we'll try to get to all of them tonight. Is Senator Reynolds?
Great. Hi, I'm happy to be here.
Hi. Hi. So for those who don't know, we have a big crowd tonight. Could you tell us about your background?
Amazing. I have a cough drop in, but I may spit it out if I have to. Cut what we call the capital crud. So my name is Lisa Reynolds. It's truly wonderful to be here. I think as I wrote in the chat, I was a founder of Indivisible Oregon with Erica Goldman and a couple other folks on New Year's Day of 2017 as we were getting ready for Trump's first inauguration. I also was one of the early people in the COIN network. I was charged at that time, I see Mary Chafin here. I was charged at that time with tracking some of the healthcare bills that were going on in the legislature. And then in near the end of 2019, I decided to run for office. I had a tough primary in 2020, but I won, and I've been in the legislature since 2 terms as a state rep, and now I'm a state senator. The background that's really important to all of this is that I'm a pediatrician, and so I really bring not just the science and medical background into everything I do in the legislature, but really thinking about babies and kids under the age of 5. And how important it is to invest in that population. And that's kind of what drives me to do this work. And so I'm happy to have a conversation with you all today.
Thank you. So you're a first-term senator, and you're already a committee chair, the Early Childhood and Behavioral Health Committee, which I understand they formed to take advantage of your experience.
Yeah, it was kind of a custom-made committee, quite an honor. And I'm working on a lot of maternal child health bills, and that just comes right through my committee, which makes it nice to be kind of in control of that agenda for sure.
So COIN has a legislative team, and we've been following your Momnibus
great
policy package. Can you give us an overview of what bills are in that package and what you hope they'll each accomplish?
Yeah, so I mean, this is really like kind of what I was alluding to earlier. I mean, certainly I've known as a pediatrician, right, how important those first years, if not months, are in life, how that early relational health, what I call that normal serve and return between a caregiver and a baby, how that not just builds that relationship and security for the baby, but it literally architects a baby's brain. And there's an economic principle called Heckman's curve. This is a temporary tattoo of it, so it's kind of backwards, but the earlier we invest, I know this is tiny, the earlier we invest, this is prenatal and like first year of life, the earlier we invest, the greater that return on investment is. So I have temporary tattoos of this, if you're ever in the building. And yet as a state, we tend to not really invest very much in 0 to 5-year-olds or 0 to 2-year-olds or whatever you want to say. So I kind of, and then when I came to the legislature and saw really a lot of the ramifications of our child welfare system, right? If you guys read the Oregonian regularly, you will see about once a month there's a terrible outcome for a child in foster care, whether or a child who's been missed, who's been abused. And I've come to understand that if we could just surround families with what they need at the front end before they get into the situation where children are endangered, everyone would do a lot better. And the state would also save money. So I kind of came up with this Momnibus package of policies. It's housing, if we could really make sure people have safe and stable housing for that, from pregnancy to that first year of a baby's life. It's providing mental health services for pregnant people and for parents of babies, because we know that mental illness is a real strong driver of maternal morbidity, which is illness, and mortality, which is death. And that includes substance use disorder treatment. So if we could improve behavioral health services for that age group. So it's housing, behavioral health services, ending poverty, right? Poverty mitigation through child tax credit. I'd love to do some direct cash transfers. This probably isn't the year to do that. There are some pilot projects of just giving people money. We know that ends poverty. We know it happened when we had the enhanced federal child tax credit during COVID. And then lastly, doula and traditional health worker support. So, you know, our country has the worst maternal morbidity and mortality rates among wealthy nations. Our infant mortality rates are rising. And by providing some of these services, we can reverse that. But doulas kind of help mitigate a lot of that. So if there's a doula who's with a person during pregnancy and at the birth and even doing some postpartum supports, we just see improved outcomes with that alone. So those are kind of the four things we're looking at.
Okay, I had a specific question about the doula certification. Will a practicing doula's certification from a qualified trainer or organization be accepted without any further training to receive the benefits? And the bill is SB 692.
Yeah, I think I think the word would be licensed. If a doula is licensed, they already are eligible to receive reimbursement from patients who are on Medicaid. I mean, Oregon does some really incredibly innovative things. I'm really proud of that. We want that to also apply to people with private insurance. So that's partly what that does. We also are going to build a perinatal task force to really look at various types, not just doulas, but lactation counselors, traditional health workers, community health workers, things like that.
One of our legislative team members noticed that SB 692 and 693, which are the doula bills, they increase access to doula services and other culturally specific perinatal services and establish the task force that you alluded to, that these bills are exclusively sponsored by Democrats, and yet they should be nonpartisan maternal health bills. So we were wondering, are you seeing any Republican support for these bills?
Oh, yeah, Republicans love this. And I'll be honest, that's partly on us. Like we didn't go around and get the signatures. But yeah, Republicans love this stuff, And so one thing I will say, because I know I'm among friends. So we have a lot of swag. So we have a button maker that I got from Dick and his wife. We have a lot of swag. So here's my Momnibus. So those little baby feet is actually the logo of the anti-choice movement. And I'm like, I'm freaking pulling these baby feet. I'm co-opting these baby feet, just like we need to co-opt the flag. And I mean, I think this is the most pro-life bill you could ever want. So we do have bipartisan support. We just haven't really done the work of getting people to sign on. But I will. I can certainly do that. Like Dick Anderson, Senator Anderson at the Coast is really a big fan of all this work.
Well, that's great to hear. So how are these Momnibus bills progressing through the session, and how can we help?
Yeah,
them?
so everyone loves this stuff. I don't know, I will just say we've done a really good job of marketing it, right? Like I said, partly with our bling, partly with I've been on, several news stations talking about this. We've gotten a lot of news coverage. Oh yeah, bill numbers I'm looking at my cheat sheet. Sorry, 694, 691, 692, 693. Also, I'll put in the chat. I have a Momnibus webpage, which has all this information.
That'd be great.
So everyone loves this stuff. Everyone gets it. The question is, are we going to have the courage to really do the upstream preventative investments when we have so many crises that we are responding to? But we know that the governor and the state really cares about our behavioral health system and housing. And I think people do really care about housing babies. So we're kind of in those lanes that are already priorities for the state. So I'm just like, we have to just devote part of this lane to this priority population. And if we don't, I think it's not clear to me that services will go to that population.
Okay. So we have to talk about what's happening in Washington and the dramatic cutting that is going on there. How is what's happening at the federal level affecting your ability to pass bills that require funding?
So, I will say, what we're hearing from the budget writers, which is Senator Kate Lieber and Representative Tana Sanchez, is, we just don't know, right? And that not knowing is certainly unsettling, but I don't think we will know before our next biennium budget is due at the end of June. So we do budgeting for every 2 years, starts July 1st of the odd numbered year. So we have a budget that starts July 1st, 2025. We have to finish it by the end of June. I don't think we'll have received news of concrete Medicaid cuts before then. So we're going about our business and building a budget. We're being a little bit conservative. We're not doing a whole lot of one-time funding things, right? But we still have, the work of the people, right? So I would say it's weird. It's a little bit, it's hard because I am literally losing sleep over what's happening in our country. And then we come here and I have a hearing on ending the sale of flavored tobacco, which is my other priority. I have a button for everything. And it's important we do that, knowing that at some point, if there's a big hole in our budget from Medicaid cuts or other cuts, TANF, SNAP, then we're probably going to have to do a special session and try to figure out some sort of rebalance. So,
Okay.
so it's a little bit of yes and, like we're kind of going about our business knowing that there's gonna be a reckoning at some point.
Okay. Does that affect, you said it may affect like one-time funding, or I may have misunderstood.
Yeah, I think we're less anxious about doing some one-time funding things right now and just figuring out, what are the services we've got to make sure, remain uninterrupted and things like that. But,
Okay.
it's hard to know. I mean, I'm not a budget writer. I'm not on budget committees. I kind of wish I were. So it's a little bit of a mystery to me, but we'll see what happens. I mean, I think we have work we're doing, knowing that there's a little existential threat. I kind of said to someone, it's like that little cloud that Pigpen has following him around everywhere, right? That's how I think we all feel a little bit right now, but we have to keep moving.
Okay. Well, tell us what your other priorities in the legislature. You just mentioned the flavored tobacco.
Yes, I want to end the sale of flavored tobacco statewide. So these flavored tobacco, and I have God, we have a whole bunch of products. I mean, it's ridiculous. These products are so marketed to kids with bright colors and candy flavors like, green apple and strawberry shortcake and candy corn, clearly marketed at kids, clearly being used by kids who never in a million years would light up a cigarette, and then they get addicted to the nicotine. So it's pretty grotesque. And I've had patients who are vaping, and parents are finding their vape pens and all sorts of things. And they tell me that feeling of not being able to quit. Like nicotine is, I mean, I don't quite understand what this means. I mean, I do, but it's like, it's more addictive than heroin, they say. Very hard to quit if you're addicted. So the tobacco hooks these kids with these, marketed to kids, little, colorful vapes. So we want to end the sale of all flavored tobacco in the state of Oregon. Washington County and Multnomah County commissioners have already voted to do so, but it's a little bit snagged in the courts because of some state laws. So that's a big priority for me right now. We're also working on banning cell phones from schools. I feel like we kind of joke, I ban all the fun, right? I want to ban guns. I want to ban flavored tobacco. I want to ban cell phones. So what I would like is a no cell phone use from the morning bell to the end of day bell in schools. There's several districts who are doing that, several schools who are doing that. I think we should do it statewide. I think we have a great argument to be made about kids' mental health, about school performance, and about school attendance, all of which are made worse by the presence of phones and bullying. And ban the phones. Thank you. It's funny, the school boards, Oregon is a really strong local control state when it comes to school districts. And I think the school board is going to be mad at us for banning the phones, but I'm hearing from lots of teachers, you be the bad guy, right? Like if it's subjective as a teacher, they just beat me down, right? I mean, not beat me, you know what I mean? It's hard to be the bad guy when the other teachers might say, oh, it's okay to use your phone. So if we can do a statewide ban from morning bell to evening bell, with exceptions, of course, for kids who need it for IEP or for patients who are diabetic who use their phone to track their sugars. Of course, we would have exceptions for that. There's a couple other bills we're working on. These dusters, this is like some random thing. Those dusters you use to clean off your computer keyboard? They have like a narcotic element to it. And there was a situation in Oregon where a young man inhaled it and then drove, and he actually killed a young woman. And that young woman's family is looking to change how these things get sold in stores. And then gun bills. So last week, this week, and next week will be when we're hearing several bills to decrease gun violence. We have a bill that would license gun dealers. There's a lot of state license for gun dealers. Right now, there's a federal license, but it's not double checked. There's not a whole lot of rules around, like, do your employees need to go through a background check? Well, they certainly should. So we're looking at state license for gun dealers. We're looking at requiring people to be 21 to purchase guns. Because you can purchase guns at 18, you can purchase long guns at 18. We're looking at actually leaning into local control and allowing local jurisdictions to ban guns from their premises because they don't have the right to do that now. 72-hour waiting period from the time you think you want to buy a gun till the time you can get your hands on it. Ending the sale of bump stocks, which make a semi-automatic weapon into a fully automatic weapon. And then also some fixes to Measure 114, which was just upheld by the state circuit court. So there's a lot of activity right now on gun violence prevention. I don't think all of it will pass, even though all of it should and all of it makes sense. But because it becomes such an emotional topic in this building, we're going to have to pick and choose what to really focus on.
Okay. There's also a number of anti-hunger bills like
Right, of course,
meals
yeah.
for
Food
all.
for all Oregonians, free school meals for all. Yes, all really important stuff.
And a lot of those seem to depend, of course, on federal funding
Yeah.
continuing SNAP, and it
Yeah.
doesn't look like it will. And food banks are already feeling some cuts.
Right.
So what do you think about the prospect of those bills, and specifically the Food for All Oregonians, the school meals for all, the package of bills for college students, food,
Right.
textbooks,
Yeah. I
housing?
mean, I think the challenging thing at the end is going to be the funding. I think most people, and I think those have wide bipartisan support. The cool thing about the school meals part, the meals that are served at schools, we're already at like 94% of kids have access to free school meals. And this has been just over the last few years. Obviously, that can change if the federal government pulls their funding on it, and that's certainly likely. But yeah, I mean, I was at a hearing for the Marion Polk Food Share, and the head of that organization said nothing good happens when you're hungry. And I think of kids when they're hungry, and it's like a switch goes off in them, right? And I think about all the money we spend on K-12 education, a lot. And why would we put a hungry kid in that expensive, what I'm considering an expensive seat, right? Let's really make sure that kid is nourished and ready to reach their full potential for the day.
It makes sense. I have a question in the chat. What are the gun bills that you referred to that you think will really get traction? And
I don't know. I mean, I think we should do all of them. We are looking at having and combining them. So it's like one vote. There's a whole thing about we just want to take one vote. Maybe you can combine some of the gun bills.
okay.
I think all of them make sense. We really haven't passed a major gun bill in 4 years. I mean, we did pass ghost guns 2 years ago, but our last really big gun bill was 4 years ago when we passed safe storage and when we prohibited guns from being in the state capitol and at the Portland airport. So, anyway, I don't know how it's going to shake out. I really like all of them.
So are there bills that would or could result in a Republican walkout?
Well, you know what? I mean, here's what I would say. I think 2023 really codified that if they walk out, they can't run for reelection. Okay. I think they thought they were going to be able to game that. I think they thought they're going to be able to appeal it to the courts. Obviously, the courts sided with the voters. So if they're willing to not be able to run for reelection, sure. But I think the people who can't run for reelection are pretty upset that they're lame ducks now. I serve with a lot of them in the Senate because it was the Senate side. So yeah, we can't. Yeah, yes, I think it's very possible they walk out, and it could be guns. We don't have a big reproductive rights or gender affirming care bill this session, so it would probably be the guns.
There's also the Freedom to Read bill, SB 1098, that seems to be moving.
Yeah, it doesn't actually even do all that much, but yeah, if they wanna end their career over that, so be it. I would argue, I mean, I think if they start walking out, I think we start. I would argue, not that I'm in charge, like we should have floor sessions every single day, 7 days a week, so that they hit their 10 absences as quickly as possible. And they just really have to, and then once they hit that, right, then we're in a tough spot, right, for sure. But I'm not sure. There were several who chose not to walk out 2 years ago, and they're still here. And then there's a bunch of new Republicans. So I'm not sure they're willing to give up their service to the state over this.
There was a question in the chat about the anti-vaccine fever, and I wanted to broaden that a little. We have kind of a nut, right, running the Health and Human Services in our country and advocating cod liver oil to stop measles and that sort of thing. So how do you as a physician, how do we counter that as a legislator and a physician? How do we reach people and
You can't.
stop that disinformation?
I mean, I will tell y'all, I mean, I was in exam rooms in 2021 with families who's I've known since their 15-year-old was a newborn. And they were telling me things about what the COVID vaccine did. And I'm like, it's just not true. And they're like, well, you have your numbers and we have ours. And I'm like, so how do you even have a conversation? Like someone that I think I would have a fairly trusted role in their life. And it's very disheartening. I mean, it's been very disheartening for me professionally as a pediatrician. It's still the minority. But I will tell you this, I'm taking a leave of absence right now from clinic starting in February. When I was in the fall, as we had flu shots, so we had flu and COVID shots in the fall, right? There was a COVID booster, new version of COVID, and then the annual flu shot. And people would be like, I don't know. I don't think I'll do the COVID. I'll do the flu, or I'll do the flu, but not the COVID. And then everything else they were fine with. And every once in a while, I don't want my patients to feel uncomfortable, right? I don't want to be a jerk, but a few times this woman's like, I'll take the flu shot, but not the COVID vaccine. I'm like, I'm curious about that, right? I'm curious about that. Why flu shot, but not COVID vaccine? She's like, well, isn't COVID at this point just kind of like the flu? I'm like, you're not wrong, but you just said you'll take the flu shot, but not the COVID vaccine. Like wanting to maybe pull them into their weird conspiracy theory about mRNA vaccines or Bill Gates, tracking us. But I mostly made her feel uncomfortable, and that's not necessarily great. I was calling people on this stuff early on when I felt like it was life and death. It's not life and death anymore, I think, the COVID vaccine, but it is it's incredibly disheartening. I mean, it's definitely something I have shed tears over when I think about, for me, I'm like, well, we can't really blame the Texas measles outbreak on Trump. I mean, he just became president, but that complete undermining of science and trust in the doctors and trust in the vaccines that was seeded by Trump is totally why we have low vaccination rates in Texas. And when I think about it's ironic that Trump was actually responsible for the very quick, near miraculous development of the COVID vaccine, but then he just has kneecapped it, right? And it's frustrating. I remember, I live off Northwest 23rd in Portland near Good Sam Hospital, and I would hear the pots and pans at 7 o'clock every night. It was really touching. And now I just feel like doctors are pariahs, and it just shocks me. And I will say, even when it comes to making policy, not even talking about vaccines, there still is just not as much attention to science as there should be. That's not Trump. I think that's just legislators. That's why we need more scientists and more doctors in the legislature. And I'm not tracking the chat. I'm trying to.
No, I'll do that. That's fine. So I'm circling back to this issue of funding, the funding shortfall that we're going to face for Medicaid likely and others. There's a question in the chat about, and you've kind of answered this, but is there any strategies that the Democrats are discussing to sustain Medicaid?
Well, I mean, Chuck Schumer, right, obeyed and advanced. He gave over the keys to the kingdom. I mean, certainly at the federal level, the Democrats have no foot to stand on, no room to negotiate. Why would Republicans ever in a million years negotiate with us? In terms of the state level, if there really is a, about about a third of Oregonians are on Medicaid. Over 50% of kids are on Medicaid in Oregon. And a big chunk of that is subsidized by the federal government. So if that money goes away, we're either going to have to dilute the services we provide, or we're going to have to just throw off demographics of people that we've decided to cover. I think it'll be that there's only so much we can dilute out to save money. So I think right, we're not going to throw off adults with disabilities, but we will throw off the we have adults who are not citizens are the newest population to receive Medicaid in Oregon. And because the federal government doesn't allow that, those are paid completely by our general fund, by Oregon state taxpayers, right? So at some point, that's a population that's going to be at risk of losing Medicaid after having only secured it the last few years.
I was in a meeting this afternoon with a local city councilor, and she was offering the possibility, what if, and this is a question in the chat, what if we canceled the kicker or put in some kind of real estate transfer tax to raise money to supplement these federal cuts? Is that something that could happen or is under discussion?
So the only way to cancel the kicker, to really do away with it, is through a ballot measure, because it's a constitutional right. Isn't that shocking? Constitutional right to the kicker. So it'd have to be a ballot measure. Every time we've done polling on it, the voters don't want to do away with the kicker. Not to say that they wouldn't in the future, especially if we're in dire straits, but that's certainly not going to be a short-term solution. What has happened with the kicker, though, and the kicker, and this is oversimplified, the kicker is if we collect more in tax revenues than we predicted we were going to, we have to give back the excess. But one thing I will say is we have a new state economist, and our understanding is he's going to do a better job at forecasting, so there'll be less of that delta between what he's expecting, it's a he, what he's expecting we receive and what we actually receive. In the past, it's been quite a big gap. We're hoping that that gap gets smaller and that we're just, hanging on to more of that money. Kicker reform is always possible without going to the voters, like maybe saying, hey, instead of, just writing checks that are also based on what you paid into the system, so the richest people get their bigger kickers. We could reform it. I will just tell you, man, I'm sad to say, I know we sound weak. There's not a lot of appetite for it, because I think it would be really hard to get enough people to vote for that, even in the legislature. Because the kicker, I know you all are, enlightened people, the kicker is very popular among the average voter.
What about something like a real estate transfer tax?
Any new tax that we implement has to get a 3/5 vote,
Okay.
which means 20 20 senators and 40 state reps, and it's very, very hard to do. So I if not near impossible. It's interesting, there's a tobacco product called Zins. I don't know if you guys are familiar with Zins. It's a little packet, people put it in their little tongue. It's a little packet of nicotine, and it's currently totally unregulated because it's not actually tobacco, it's just nicotine. Cigarettes are taxed at a really high rate. The vapes are even taxed at a decent rate. So we're like, well, we need to have Zins be taxed too. Actually, we want to do away with them, but it would require, because it would be adding a new product of stuff for taxation, it would require a 3/5 vote. And we don't think we can get that. It would require Republicans to do, every single Democrat and some Republicans to do it. Very, very hard to raise taxes, which maybe isn't a horrible thing, but we may get to that as we all start seeing people losing their Medicaid. The percent of Medicaid is higher in rural counties, i.e. Republican counties, than it is in blue counties.
And I imagine that's true of SNAP benefits and
Right. Child poverty is higher in rural. Yeah.
rural Oregon. So I want to switch gears a little and ask you about OSERA, the Oregon Coalition on Environmental Rights. There is a bill to amend the Constitution and give Oregonians a right to a clean, safe, and healthy environment. And I'm wondering if you're aware of this bill and what you think of it.
I mean, I've heard of it. Obviously, that would be a referral to the voter.
Yes,
For ballot.
yes.
Yeah, yeah. Yeah, I mean, it makes sense. I mean, it's always, it's kind of like the, healthcare is a human right. I mean, what does it actually, what kind of teeth does it have? I don't know. I haven't looked at it. As much as I care about the environment, I have not delved too much into that bill. But I think ballot measures can be meaningful, conversations. Not sure it really changes a whole lot of policy. I don't know. I'm so sorry. I haven't looked at that carefully.
Okay, well, thank you. There are a number of bills in the legislature to make inroads on the ban on nuclear power. COIN has come out against all of these bills, and I wondered if you could talk to us about those and hopefully tell us that they don't have any traction in the legislature.
I suspect nuclear power doesn't have a whole lot of traction in Oregon right now, but I do not know that for sure. We are, given this citizen legislature, I know a lot about healthcare and human services and behavioral health, and even some about judiciary, but I have not been tracking those bills that closely. None of them have come over, certainly as a vote. But I don't think we're ready. I don't think there's an appetite to really explore nuclear power in our state among the leadership.
There's a question, it's kind of been recurring in the chat, and I think people are wondering, what can the legislature do to protect us from Trump, from Doge and Musk? Is there any legislation that can be passed to anticipate any threats and stop them in some way in Oregon?
Yeah, I mean, I will be honest, we're all asking ourselves this all the time. We
Yes,
the
I
best
think that's why it
protection
came up.
for gender affirming care. We have the best protections for abortion access. We're one of, I think, 3 or maybe 4, it might be 3 states plus Washington, D.C. We're one of that small rarefied group are the only states where there's no limit on abortion, of providing an abortion. So if there's some sort of late term, fatal birth defect or whatever, people will come to Oregon to get that taken care of. We have completely reiterated our dedication to being a sanctuary state and really looking at ways to make, really reiterating that our law enforcement will not cooperate with ICE agents. So those are the main things. It's just, being proud of some of the groundwork we've laid so far. What's obviously particularly challenging and harrowing and terrifying is that, Trump is thumbing his nose at the courts. So when when the courts start holding him accountable, but he just ignores them, then we're really in, I don't use this term lightly, but we're in Third Reich land, right? We're in Nazi Germany land, and we're getting awfully close. And I think, I really ask myself, like, what am I willing to die for? Or like, and I mean, what should or could I be doing differently as a human at this time in history? I'm not sure yet. I'm just not sure, but it's obviously an incredibly terrifying time, as the Republicans, one of my colleagues here said, what are we going to become, the land of little factories and no longer be innovative, no longer find the cure for cancer? No, I mean, right, all that stuff is being decimated, no longer be the creative spirit and innovative, entrepreneurs. And I mean, all that stuff is going away, and it's horrifying. And it's going to be, I don't know when we'll say, wow, we've reached the point of no return. And I hate to be so glum, but I know you're all feeling this, right? It is, and we're pretty helpless. And God damn it, Chuck Schumer, right? Just doesn't totally played this wrong, I believe. I mean, oh my God, right? It'll be bad if the government shuts down. What do you think they're doing now? And now you are complicit. I mean, my understanding is any lawsuit against government funding or freezing of government funds is kind of null and void, because with the continuing resolution, they can do whatever the hell they want. And Republicans have given over their power too. This is what is a little interesting to me. Republicans have said Congress no longer controls the power of the purse, right? That's, I don't think those words are actually in the Constitution, but they're certainly in the Federalist Papers, right? Congress is the power of the purse to make the budget and to decide what lives and what dies. They have completely handed that over to Trump. There's also a lot of chilling things going on with universities, right? Where people are scared to speak up. So we are headed into some very, very terrifying territory. I see Vesna's here. So I've been trying to do little videos. And I did a little video today about the constitutional crisis, the three branches of government. And I will tell you, people are so mean. Mostly the haters are like, oh, you and you stupid Democrat, and you're awful, and they misspell all the words. But I'm going to keep speaking up, but it feels like too little. Feels like too little right now. But I think all the stuff you all are doing about it, I think Maxine Dexter, who's a good friend of mine, I'm so happy she's there. It helps when her phone is ringing off the hook. Maxine will always do the right thing. But if we can stiffen her spine and just give her that confidence and give her that, because these are hard things to do, like keep doing all that. And then, my God, we got to, show up at every Cliff Bentz event possible, but I'm sure he'll stop having those soon.
So keep calling. I don't want to leave it on that note. There was a question. Let me go back to legislation. There was a question in here about water bills, and we haven't talked much about the environment, but there's a few bills in the legislature to help protect water, particularly in marginalized communities, like not having more factory farms in groundwater management areas. And there's a bill to stop spraying, or at least account for pesticides and that sort of thing that you spray on crops and gets into the water. Is there any, do you have any sense of momentum on any of these bills, or any support that you have for them?
I think that these bills tend to be pretty highly negotiated, and they tend to come out bipartisan. And that's because there's a disproportionate effect on water policy in our rural communities. So I suspect we will get to a good spot on all those things. I'm not at those tables.
Okay.
But it is, and Recovery High Schools. Oh my God, yes, Recovery High School. So we had bills last week on youth substance use disorder prevention, and Recovery High School funding is definitely a high priority for everyone here. So thank you, with a couple new ones coming online.
Well, Senator, thank you so much for your time tonight.
Yeah.
We really appreciate it.
Yeah, thanks for all you're doing, and yeah, it helps to know how many people are out there kind of banding together to save our country.
Thank you.
Okay. Thank you.
Thank you.
Bye-bye.
Bye.
Thanks, Laura. Super informative. Good to hear someone working in Salem on our behalf. We hope that all of you know who your representatives are in Salem, both in the House and the Senate. If you don't, please go and look it up so you understand who represents you in Salem. A lot of people haven't been paying attention. I'll say that out loud. So it's really important that you go find out who represents you and whether they're doing a good job. Our COIN legislative team has done an awesome job of putting together a page on our website of bills that you can track. And there you go. Debbie's got it in the chat already. So you can go there and you can find out which bills need testimony ASAP. Don't hesitate, even if you just can send an email and say, this is where I stand on it. It's important. The more emails they get from people, the more comments they get from people, the stronger our case will be to get these passed. And they need to hear from us. So Debbie, do you have anything to add to that before we go into general stuff?
Well, I just wanted to say we've tried to make it as easy as possible on the COIN legislative team webpage. So look for the bright pink action alerts, because those are bills that are either having a hearing this week or they need a nudge to get across the finish line. And so we've given you links to either submit testimony if there's a hearing this week, or links to the committee, so you can write to committee members and say, keep this bill moving forward. So look for the action alerts and things that you can actually do to help bills like the Momnibus package of bills keep moving through. And the gun legislation, there's 2 bills this week on gun safety. One had a hearing yesterday. You can submit testimony on that one until 3 p.m. tomorrow. And there's another one that has a hearing on Thursday, and that one's open for submitting testimony right now. Super easy. Once you submit testimony, you're going to go, oh, that's so easy. I can do more of that. And we invite you to do as much as you have time for, because it's kind of what gives our legislators cover to say, oh, there are 500 people that submitted testimony in support of this bill. I have to vote for this. I have to vote yes for this. So it's how we communicate to them and let them know we're behind something. So please take some time, go to that website and submit testimony on things that matter to you.
Debbie, can I just add one thing? The Ways and Means Committee decides where all the money goes, okay?
Yep.
And they are going on the road. They're going to go to various locations around Oregon. So that's also posted at the top of our website. Find the nearest location to you where they're going to be and go down there with a list of your own spending priorities and talk to them, testify. They're taking testimony. They want to hear from all of us about what your priorities are for the legislature. And I think it's a great opportunity to testify in person. It's easy. You can also submit written testimony if you don't feel comfortable doing it in person, but take a look at where they're coming and go down and talk to them about the bills that matter to you or the funding priorities that matter to you.
And if they're not coming to a place close enough to you or at a time that you can get to, then you can also write to the members of the Ways and Means Committee and say, I couldn't make it to one of your road shows, but these are the bills that really matter to me. And just give them a list. Say, please make sure that these bills get funded. And, give them a personal story about why those bills are important to you, because we hear that personal stories really stick with them and make a difference for them.
Awesome. Thanks, everybody. I'm going to switch tactics here because everybody wants to talk about April 5th. April 5th is the National Day of Action. We have been calling for a national protest now since Inauguration Day, really. And finally, Indivisible and a coalition of other groups have come through and have asked everyone everywhere across the country to please organize something. Teresa, you want to talk a little bit about what we've been trying to go through down here in Southern Oregon?
Yeah, so we've been trying to connect with the 5051 people who are very new, and fortunately, the best favorite part for me about 5051 is it seems to be attracting younger activists, which I know for a few of us we've been struggling with since 2017 to get the people under 50 to come in and engage. So they're filling a big hole with all of their pop-up rallies and what they've been doing. This event on the 5th, though, from our national, we've been kind of holding back locally down in ORD2, which is in the Southern Oregon part of the state, from doing a big event until we got our marching orders from national, because we've learned over time that when we coalesce and have a big group of us all active on the same day, we get a lot more attention, and we're much more efficient in our messaging and getting the White House to look at us. They've said this is the first one. We don't even need to worry about not being in DC this time. There's going to be more and a bigger, larger event in our near future that's going to call on all of us to maybe show up in Washington if we can, and if not, in our communities. In Southern Oregon, we've picked a very, very visible spot on a highway that we're going to have a rally beginning on the 10 o'clock on the 5th. And I would love to hear more about what your groups are planning, and if you're planning anything yet. I know that the national page has a really good information and easy way